Let's talk in this video about the conduction system of the heart. And to understand what's going on here, we need to remember that muscles in general, to contract, they need signal from nervous system. We saw that in AB1 when we talked about the action potential transmitted to the muscles, to the skeletal muscles through the neuromuscular junction. Cardiac muscles are no different. Cardiac muscle still need to be stimulated from nervous component. The difference would be that those nervous components are located within the heart. So the cardiac muscle cells receive their stimulations to contract from within the heart environment. What does this mean? Think of that the heart has its own brain, or actually instead of brain, let's say its own nervous system. This is more accurate. This means if I take the heart out, put it in a table, and give salt, give energy, ATP, it will keep pumping by itself, by its own. What we want to understand is this, the conduction system. Those cells, the heart's nervous system, we call it the conduction system. And that's the one that stimulates the cardiac muscles to contract. Now, one stimulation would last around 225 milliseconds. So that is the time needed from the initiation of the action potential all the way until the end, until the repolarization of the last cardiac muscle in the heart. So what are those components of the conduction system of the heart? The first one is something known as the sinoatrial node, SA node. And as you can see, this is located at the top of the right atrium. And it sends fibers to both left and right atrium. Okay, this sinoatrial node, this is what we will call the pacemaker of the heart. This is the main one. Okay, this is the one that you can think of it sets the rhythm of the heart, the heartbeats. This can stimulate the heart or sends stimulations to make the heart beats between 75 to maybe even 100 times beats per minute by its own. That's why that's like the pacemaker of the heart. This is the main one. Okay, now before going further, we need to understand that atria are going to depolarize and repolarize at the same time. And the same for the ventricles. Both left and right ventricles will depolarize and repolarize at the same time. But we cannot have depolarization in the atria and the ventricle at the same time. No, it's only left to right. Those two will depolarize and repolarize at the same time. Why I'm saying this? Because we need to understand the following node. Those signals that sent from the SA node will arrive at the atrioventricular node. This is the second one. So this is the first component. This is the second component. This by itself can induce beats around 50 beats per minute. So this is also an important, induction system of the heart. However, the thing about it is that it delays the signal. What does it mean? Let's go back to the SA node. When the SA node sends the signal to the muscles of the right atrium, it's a close, right? The fibers here are very short. Versus here, yeah, they are still short because the heart is small, but not as short as this one. So here, the signal will arrive to the bottom of the atria before maybe the signal arrives to the start of the atrium, of the left atrium. So this means if those signals arrive to the SA node and the SA node sends them immediately, we might have depolarization of the ventricles, whereas still the left ventricle is maybe just started to repolarize, or maybe it's, still in the depolarization. This might cause contractions in the atria and the ventricle, or at least in the left atrium and the left ventricle at the same time, which is something we don't want to have. So that is the point of delaying the signal. The SA node, the AV node will delay the signal to allow left atrium to depolarize and repolarize before ventricles. Now, how does it do so? Because it has lower sodium gates. So how does it do that? The cells here making the AV node are small, right? And think of that, therefore they will have less sodium and potassium ions gates, versus here we have like big cells from the SA node. So there are plenty of signals coming, but to process those signals, we have smaller cells to process them. And therefore, that is where the delay is going to happen. Okay, so the delay, the main thing for us to understand that at the AV node, there is a delay. And this delay is to allow the left atrium to depolarize and then repolarize before the signal is transmitted toward the ventricles. So from the AV node, where does the signal go? It goes through a bundle of fibers. We will call them the atrioventricular bundle, or sometimes we'll call it the bundle of Hess. This is just fibers to transmit the signal. Remember, we're talking about action potential. And this signal then will be transmitted through the interventricular septum through the right and left bundle branches. This is number 4. Right and left bundle branches. As you can see, those as they are moving to the apex of the heart, they are sending, fibers or neurons to the papillary muscles, to the inner wall of the heart. Then those bundle branches will reach the apex of the heart, and then they will turn and walk back on the outer walls of the heart. Okay, so they will walk on the outer walls of the heart. Those would form what we know as Purkinje fibers. Purkinje fibers. Okay, so it's SA node to AV node to AV bundle to bundle branches and to Purkinje fibers. Okay, so this is how action potential is through the heart. Okay, before moving forward, I need you to notice that the action potential, as it's moving from the SA node toward the apex of the heart, every time it passes through a group of muscles, it's going to depolarize them, like a dominoes effect. So those dominoes will keep falling, or those cells will keep depolarized, right? And then notice that we said the Purkinje fiber will go up, back, to the on the outer walls of the heart. So here, if we continue with the same concept, it means that this area of the heart, the lower part of the heart, will get depolarized before this part, before the outer part of the walls. And that's also on purpose, because later we will see it when we are squeezing the heart. When the heart is contracting, it tries to squeeze the blood out. So we need to start squeezing from the bottom of the heart toward the top. The blood needs to leave. But if I squeeze the entire ventricle at the same time, so the squeeze came all at the same time, then the heart will be trapped. Like it will be really difficult where to go. But here, when we squeeze it from the bottom of the heart, then we are pushing the blood outward. It's very similar like if you have a toothpaste. Okay, if you are like me, you will have, or you would like to squeeze that toothpaste from the bottom, right? To make sure that everything here, and as you are consuming it, you are pushing them forward. But if someone in your family is not doing that, you will find that the toothpaste is squeezed from here, and toothpaste is all over the place. So the idea is to squeeze from the bottom here, so you will make sure that the blood is pushed out, or trying to push as much as you can of the blood outside the heart. So this is what this map will show you, like the signal, the action potential in purple, and where is the depolarization and repolarization is happening through the heart muscle. And this is a cycle, okay? It's a cycle. Once it starts, it ends, and then it starts again. And we said this will take around 225 milliseconds. And remember, this is the electrical signal. This is not the contraction. We still need to talk about the contraction. But this is the electrical signal to stimulate the muscles to contract. Make sure you understand this. We said that the heart has its own nervous system. But does this mean that the central nervous system doesn't have any influence over the heart rate? In fact, no, it has. And here, if you remember, we have the autonomic nervous system. So the heart receives autonomic innervation from the CNS, from the central nervous system. If you remember, the autonomic division is the sympathetic and the parasympathetic. One would activate, the other one would inhibit. So here, in this case, the sympathetic is going to activate the heart rate or increase the heart rate. Parasympathetic will try to inhibit the heart rate or slow down the heart rate. For the sympathetic division, it will come through the sympathetic cardiac nerves. From their name, they are sympathetic. They will innervate with the SA node, with the AV node, and with the bundle branches. The bundle branches inside the interventricular septum, and maybe some of them will go to the Purkinje fibers. But that is sympathetic. So when the sympathetic is coming, remember the sympathetic is fight or flight. we need to increase the heart rate. So we would ask the SA node to send more signals, more signals, more signals. We'll stimulate the AV node to send more signals, and that will cause the heart rate to go up. However, for the parasympathetic, it comes through the vagus nerve. If you remember, the vagus nerve is cranial nerve number 10. That cranial nerve, it sends signal, but only to the SA node and to the AV node to slow them down, to slow their action potentials, or to slow the rate of their action potential release. So in this case, like a damage to the vagus nerve, it's going to increase the heart rate, because the vagus nerve is like a brake. It's the brake system of the heart. So if you remove the brake, the car would keep going without slowing down. Now, if you remember, we said like the bones, and in the medulla we have the cardiovascular system center, or the cardiovascular center, and the respiratory center. This is how they would control the rates of breathing. Now, for the conduction system and the rate of contractions, sometimes we will have arrhythmias. Those are irregular heartbeats when we have uncoordinated atrial and ventricular contractions. Usually, sometimes it's because of the muscles, sometimes because of the electrical signal. Then we have two conditions, bradycardia and tachycardia. Bradycardia, when we have low heart rate, below 60 beats per minute. Okay, and this would come with, it means like low blood pressure, maybe low oxygen levels. All of those issues would appear with low heart rate. Some people, some athletes, that's fine. Okay, because typically they have bigger hearts. However, in normal people, the low heart rate, it might cause some problems. In tachycardia, it's the opposite. When we have heart rates more than 100 beats per minute. So think of this person with always, breathing heavily. This means that they are always like feeling hot and sweaty, and all of those problems. Now, usually in infants, in children, that is normal, like heart rates above 100, it's okay. And as we age, our heart rate will drop. Think, because, as we age, we are not moving that much. So we don't need, the heart to keep pumping extra amount of blood into our system. But the children, the kids, they are growing. There are plenty of growing in their bodies, in their systems, and always they need oxygen, they need nutrient, and so on. Anyway, for the bradycardia and tachycardia, those are the two conditions you need to be aware of, and as long as the arrhythmias. So I'll stop here. In the following video, we'll talk about the action potential of the cardiac muscles.